Good morning. I am Dr. George Sidrak. I am a member of Mountainside Family Practice Association in Verona, New Jersey. Our address is 799 Bloomfield Avenue in Verona. Our phone number is 973-746-7050. And I have the honor to share with you a short lecture today about influenza, or what we commonly know as the flu. And we got the address for this lecture, Influenza 101. And we all know from educational point of view, 101 always means the starting course. So I'm going to give you a basic knowledge about the influenza. I will discuss some details that we all have to know about it. And then at the end, it will be your decision to decide to get the vaccine or not, as it's always the personal decision. But I will give you all the details about the vaccine, how it works, and the benefit and the disadvantage, or what we call simply the pros and cons of the vaccination. As you see, the seats here are all open and empty because we are now in the middle of the pandemic. People say it's the second wave right now. Hopefully things will be better soon and we will get people around everywhere and we'll be able to meet in person. But for now, at least we are able to meet online. And thanks for the technology we have right now that makes things more easy, and we're able to communicate even while we're still away from each other. Starting for the influenza, we all know that influenza is called the flu, and it is caused by a virus. We call it the influenza virus, which infect the respiratory system. There is multiple viruses that actually infect our respiratory system. Some of them are very simple and weak. Some of them are strong. Unlike the rest of those viruses, influenza virus can be life-threatening. The easiest one to get is usually the common cold virus. Now we have the COVID that's running right now, and it is one of the harshest viruses that we have for our respiratory system that is also a life-threatening. If we compare the three viruses as we see in the screen here, this is the picture of the common cold virus. It's a simple virus, self-limited most of the time. This middle picture is the picture of the influenza that could be controlled with some precautions and a vaccine that we have right now. And we will discuss this in depth as we will discuss in this lecture, or I will say the short lecture. And this is the COVID-19, or what we call the coronavirus. And this is the one that we are still waiting for vaccine on, and we still have so many, debates about how it will be effective and how it works and all those things. And we're still in the middle of the pandemic, and we don't know that much as we know about the influenza and the common cold now for the COVID. There's so many things that's linked between the three of them. Mostly will be the symptoms that we get. So starting from the simple one, the common cold, as you see here in this picture, the first one here, it is a simple virus that's in contrast to the flu. The common cold can be caused by many different types of viruses, including the simple or the most famous one that we know as rhinovirus. We also have something called RSV, respiratory syncytial virus. Those viruses will cause what we call the common cold. As we all know, common cold symptoms will include, number one, runny nose, maybe sneezing, some congestion. Some people will have it only like this for a few days and it will be self-limited. Some people may get a fever, high fever that can go up to 102, 103 degree Fahrenheit, or might have severe symptoms like severe weakness and feeling like dehydrated and feeling tired. At this point, if they have the high fever or those severe symptoms, they might need to go and see a doctor, especially the kids, because they are the most one that can suffer, from this virus complication more than the adults. Most people will recover on their own within 2 weeks. Most of us will use over-the-counter medications and doing some home remedies that can help to control our symptoms. You all know we, just stay home, have some hot drinks, hydrate very well, just, use personal hygiene, and it will self-limit, within a few days, maximum 2 weeks. The common cold virus, or the common cold itself, is common. That's why they call it common. It is more than 3 million US, people suffering from this virus every year. It will spread very easy, usually self-treatable, doesn't need any care from healthcare professionals. Usually self-diagnosable. Most people, they have it, they recovered and done. Lab tests or imaging are not required for the common cold, and short term, it will end up within few days, maximum up till 2 weeks. How the common cold virus will spread? Simply, the first way of spread is via an airborne respiratory droplet, which is commonly cough and sneezing. That's why we have to cover our cough, and we have to use napkin when we sneeze. This will limit the spread. Also by touching a contaminated surfaces like any blanket or doorknobs, this will also help to transmit the virus. Also by saliva, via kissing or shared drinks. Also skin to skin by handshake or giving a hug, which is all same as the ways that the COVID and the flu also used to spread. If we look at the other virus, the flu virus or the influenza virus, which is more serious than the common cold or the rhino virus, we have 4 different types of the flu virus or the influenza virus. We have type A, we have type B, type C, and type D. The human affected by mostly type A and type B, and those are the ones that causing the seasonal epidemics of the disease, which is known in US as the flu season. Almost every winter in the US, we get a flu season, which run the days that the same as the days we have right now. Usually starts by September, October, ends up by February or March. Influenza A is the only influenza virus that's known to cause the flu pandemic. And here we came to the word that we all hear right now, pandemic, which is also known as the global epidemic. So you'll see, oh my God, pandemic, epidemic, what is the difference? What is the meaning? Actually, we have we have 3 famous terms that we use in the public health and in the community medicine about the spread of diseases. We use the term endemic, we use the term epidemic, and we use the term pandemic. So when I speak about something endemic, I'm speaking about something that's always there. So if you are going to fly to certain areas of the world where they have some diseases over there that's always there, you will have to take your precaution because this disease over there is endemic. It's always there, like malaria, like some types of fever, like like Lyme disease in certain states, like some other diseases that's endemic in certain areas of the world, like Rocky Mountain spotted fever. Also, all those things will be transmitted by certain vectors that those vectors live in that area, and that's why the disease will be there endemic. So when you fly or when you travel to those areas, you have to take your precaution before you go to protect yourself from getting the disease. Some diseases will start to come to a certain area and start to spread in that area, which will be local area. And that's what we call the epidemic. So when I say the term epidemic, I mean a disease will spread in certain area. And here, if we get the flu or the influenza as an example for us in this flu season, it could go and become an epidemic. It goes to spread through a country or some states and this will be local in some areas. It's not a worldwide or a global, and that's called the epidemic. What if the spread start to become worldwide or global? Some people will call it global epidemic, which we call it for one term, pandemic. Pan means worldwide. So as we have now the COVID-19, the COVID-19 has a global epidemic, but the short term is called here the pandemic. If you look at the influenza, you will see, okay, COVID caused pandemic, influenza can be epidemic. No, we had pandemics happen from the influenza. Influenza was able to invade the whole world and cause pandemics. And the most famous one in the history happened in 1918, influenza pandemic. That was the most severe pandemic infection happened in the recent history. It was caused by H1N1, and here you will stop and see H1N1, what's H, what's N, what's one, is more than one. So I will tell you here at this point, I'm going to cover this part in this short lecture as we will go through. So just bear with me for now, and we will discuss the details of the H1N1 and the other types of the flu virus. The H1N1, which is type of the flu virus, had a mutation with the avian with an avian origin, and starts to cause that 1918 pandemic, which was one of the harshest and severe pandemic worldwide. It lasted for 2 years, from 1918 till 1919. Some people say up till the beginning of the 1920. In the US, it was the first time identified by infections through some military personnel in the spring of 1918. Worldwide, and focus on those numbers, please, it infected more than 500 million people, which is almost at that time was about 1/3 of the world population, and about 50 million deaths happened worldwide at that time. Almost 10% of those people who got the infection, unfortunately, we lost them. In US, we were lucky. We only we had less numbers, and we had 675,000, cases, deaths in the US at that time. If you compare 675,000 to 50 million worldwide, this number was like a portion of the total. Of course, one death is, something, very, very hard to handle. But if you look at the pandemic, same as what we have right now with the COVID, it's tough. It's tough. At that time, you see 50 million deaths happen worldwide from the influenza, that we are lucky to have now vaccine for it. So again, I'm going to repeat this last sentence. The number of deaths was estimated to be at least 50 million worldwide, with about 675,000 occurring in the US. One of the largest towns that got hit by the flu virus or the pandemic of 1918, 1920 was Chicago in US. And here you see a picture from that time, 1918, 1920, 1919, pandemic for the flu virus. And you see the hospital or the area of the isolation that they had over there with the patient in, comparing to what we have right now. I feel we are blessed with the technology that we have right now, and with the improvement we did in the past 100 years in the technology and in the healthcare system and healthcare, care itself. This is a sad picture because this shows the people who died from the pandemic at 1918, 1919, and they had an issue at the time for, they had to hold the dead body for a few days to be able to bury them, because there was a big shortage at that time on the people who can work and do this job. So it's very sad. But this is the flu, this is the influenza that, we have vaccine for it right now. At that time, they had also a shortage in the nurses. And they had an advertisement in Chicago in 1918, advertisement for the Chicago School of Nursing. They demand nurses, and they say, be a nurse, and they giving an incentive here, earn between $15 to $25 per week. You see how things were different at that time. And the good part here that, I thought that we did just the one that started the online learning and learn at home after the pandemic. Actually, it was done at 1918. They start to have portion or a big portion of the nursing education to be done at home, and then they only come for the practical part. So they start the learning at home at the pandemic of 1918, 1919. Wearing mask wasn't something new that we do right now. It was actually done at the 1918, 1919, and wearing a gas mask in Chicago for the flu virus or the influenza pandemic at that time. This is also the EMS people at the time. You see how they all wearing masks and they are ready to help. This is the Spanish flu. By the chance, they called the flu at 1918, 1919, the Spanish flu. Even they were not aware exactly from it starts, but most of the people say that it was in Europe and in Spain, so that's why they call it the Spanish flu. But it wasn't confirmed the exact location that the flu started at that time. And this is a picture from the Library of the Congress. So you'll see, okay, we had 100 years ago. Do we have any more pandemics happen from the influenza or the flu? Yes, we had the most recent one happened in 2009, which was called by the influenza H1N1. And we had an estimate of between 100,000 to 400,000 deaths globally in the first year alone, 2009. Influenza A virus, as we mentioned before, divided into different subtypes based on two proteins. One is called the H protein and one is called the N protein, and those two proteins are found on the surface of the virus. So to make it simple, depending on the protein type on the virus surface, we will give it a name. We have two proteins. One is called H, which is called hemagglutinin, and the second one is called N, which is neuroamylase protein. So the H and N protein on the surface of the virus will determine the viral type. Sorry, let me correct myself, the viral subtype, because this is all type A. So the virus is type A, has multiple subtypes. It's coded for H and N. So how many H, how many N we have? We have 18 different types of the H protein, and we have 11 different types of N protein on the surface. So let me repeat myself again in the next slide. So we have 18 different types of the H protein on the surface, and we have 11 different types of the N protein on the surface. So we can have mix between both. Let's say if I would speak about the virus, I would say I have H1. H1 could be H1N1, H1N2, H1N3, all the way up till H1N11. Same, H2, H3, going all the way up to H18. So we have roughly more than 150 or close to 200 subtypes of the influenza viruses. Influenza doesn't only affect humans, or also affect the pigs, birds, horses, seals, and a special type can affect the bats. And the funny part about this, it can spread between the different, species here. So it can go from the human to the bird, or the pigs, and back and forth, and this will cause the mutation and the changes, and that's what will make some viruses stronger, and that will also make the pandemic at certain levels. Most of the flu vaccines in the US protect against the 4 different types of the flu, what we call the quadrivalent. The most famous one is H1N1, influenza type A, H3N2, and influenza type B virus. So you will see, okay, you said quadrivalent, this means it's 4. Yes, I will come to this point in a few minutes. The flu shot works by simply giving very small doses or very small amount of the virus particles into our immune system, into our body. So simply our immune system will start to realize those as a foreign material or an invader. So the body will start to react to those invaders and start to figure out how to destroy them. So simply, we don't give the whole virus. We give a very small particle of the virus that's a dead particle. This particle will stimulate our immune system to start to figure out how to fight it. Simply, our immune system will form antibodies and different ways of reaction, the complex reactions to start to defend itself against this invader. And within a few days, maximum few weeks, we will be immune. But from what? From the particles that we got in. I'm going to come to this point in a second. So if you look here to this slide, this is the Boeing 787 flight simulator. I wanted to use this example to show how the body will respond to the flu virus or any virus in general as we use the vaccine, the flu virus vaccine. Simply, when they train the pilots, they don't put them on a plane and train them. They put them in a flight simulator, which is resembling the plane, but it is actually in a lab. And what they will do, they will put them into different scenarios, and they will start to react and do their best to save the plane and save the passenger they have in the plane. So when they exposed to this exact situation in the flight, they will be able to respond well and bring everyone safe back to the airport. Same way with the vaccine. We're actually giving a very small, tiny, little dose of the virus particles to a healthy person, and this healthy person immune system will start to realize those and start to react, having enough time to form the antibodies and start to kill those small particles and destroy it and form more antibodies in our immune system. So when the actual time comes and we get the influenza virus, the actual virus attacking us, our body is prepared, well trained on how to fight this, and we will kill the virus. So simply the vaccine will not prevent the infection from coming, but it will prevent the development of the disease. We will still be exposed, we will get the virus, but once we get it, it will not have a chance to grow or multiply in our body because our body is immune against. We are going to kill it. So you will see, okay, what about the vaccine types? And you mentioned 4, and okay, I'm coming to this point at this slide. We cannot give every type of vaccine to everyone because, as I mentioned to you, there's more than 150 types of the flu. So every year, the researchers will look at what are the expected types of viruses that might come this year, and they form what we call the quadrivalent vaccine. They pick 4 of them, the most common, and they have them in the vaccine that we will get. In 2021 and in 2020, which is this year, and next year, 2021, the flu vaccine will protect against 4 viruses depending on the vaccine type. They suggest that there is 4 types. I will mention those right now. Some vaccines are called trivalent, which is only 3 components. This is for the younger people. The older ones will have the quadrivalent vaccine, which is the 4 types. So let's see how is the vaccine. But before we go over the vaccine itself, let's just discuss how effective is the vaccine. You will also hear a friend or family member or someone around you says, I got the vaccine and I got the flu. That's true. You will say, okay, you say it's true? Yes. I mean, let me just explain how things work and then we will understand it very well. What's happening for this year, in particular 2020, CDC influenza vaccines coverage reports show that the overall vaccination coverage stays for in the people 6 months of age and older during the last year, 2019-2020, was improved by 52%. At certain years, the flu vaccine wasn't that effective because they didn't pick up the actual or the right particles that came that year, or something happened in the virus itself by mutation. Last year, the vaccine effectiveness was about 52%, higher than the previous years, which means our scientists right now are more, precise in what's going on, and they have more knowledge, and they are able to pick the proper particles that's needed for the vaccine. There is a group of people that we always say those people must get vaccinated. We cannot enforce them, but we always advise them to get the vaccine. What we call the high-risk group of people. Why? Because those high-risk group of people will have a serious illness. They might end up by having hospitalization. They might end up by dying, which we do our best to prevent. Those elderly people, older adults, or young children, or pregnant women, or people with a certain underlying health condition like HIV, like asthma, or like diabetes, are the group of the high-risk people. The flu vaccines are vital for anyone at risk of severe complication and will be of benefit to everyone in this society. What is the benefit of the flu vaccine? The flu vaccine will reduce the severity of the symptoms in those who do get the flu. So you'll say, okay, I got the vaccine. Do I still have a chance to get the flu? Yes, if the flu that coming this year has some mutation and it wasn't a part of the particles we have in the vaccine, our body is not immune yet. So we will get it. But as we have other antibodies formed from other types, the infection will not be that severe. So number one, yes, I can get the flu while I had the flu vaccine already, but my flu symptoms will not be that severe. So I got one benefit here. Yes, I can get the flu, but it will be less severe. So if I am one of the high-risk group, I will not suffer that much. Also, it will lower the risk of passing the flu into high-risk individuals. So if someone who is not of the high-risk group and he or she got the vaccine and they got the flu, the chance for them to transmit that flu to another person who might be in high risk will be less. This is the second benefit. The third one will be reducing the risk of the deaths in people with hypertension. Research showed that people with hypertension having, less number of deaths happening with the use of the flu vaccine. And also will prevent 10 of thousands of trips to the doctors each year. I didn't have it here, 10. It will also save thousands of days of work. Imagine if you are out of work sick. As a member of the society, we all are productive. We help to grow up this country. Every day we work hard. So simply when we have days off, when we are sick, this will, even I'm a one person, but if you have it all in total, it will affect the whole society. And we want our country to be always the best and the fairest. So we need our people to be always the healthiest to be able to achieve this goal. CDC said, and those are numbers, the estimate that the flu vaccine between year of 2017 and 2018 prevented, you will see this is an old, but usually we have to be behind a little bit to get the actual number. So at the year 2017, 2018, the flu vaccine prevented 6.16 million illnesses in US, 3.18 million medical visits, 90,904 hospitalization, and 5,700 plus death. So we saved 5,700 lives by giving the vaccine at that year. Flu shots also allow the development of community immunity. If enough people get the vaccine, the flu is unable to spread rapidly through communities, and as a result, people in high-risk group are less likely to get the flu. So simply, as we get the vaccine, even if I am healthy, you will say, I'm healthy, I don't need it. No, actually, if you are healthy and you get it, you actually will protect someone else that might not be as healthy as you are from getting the vaccine, from getting the disease through you as a transmitter or as a carrier. You will see, okay, you are a doctor and you would like to support the vaccine. No, as a doctor, I have to tell you the truth. I will tell you the negative points of the vaccine. Some people might have some side effects. Let's just speak by numbers. Some possible downsides of the flu shot will be, number one, the flu shot is only effective between 40 and 60%. So you will say, okay, for every 100 who get the flu shot, there's a possibility of around 40 people who might still get the flu. Yes, but let's go back to the other slide where we said that even if we get the flu, it will be lesser in the severity and it will not spread from us to others that fast as it happened without the vaccine. People will say, okay, it takes up to 2 weeks to start working. Yes, that's why we have to get the vaccines early. They'll say, okay, it's September, yes, but we have to start it in September to give you protection by the start of October, which is the flu season. Some people will say, okay, I got the vaccine. It was very painful, or it was painful. I got some redness. I got swelling at the site of the injection. I couldn't move my arm for 2 days. All those are possible side effects. But there is nothing in the life that doesn't have risk. Being in this building right now, which is a safe building, is a possibility of something that might happen and cause harm to me. I will not stop being in a buildings. We all drive, and so many of us exposed to car accidents. There's so many plane accidents happen, and we'll never stop flying or stop driving cars. So we have to have some risk, and having mild side effects like pain, like redness, like swelling is something acceptable for the benefit of the vaccine. So overall, you will see also, okay, how long it takes for the vaccine to work. I said it starts within like 2 weeks. How long it will last? Usually vaccines, immunity can protect us for, at least 6 months. Could be less, could be more. Yes, our numbers are not, solid numbers because we cannot guarantee every number. We always say in the medical field, I cannot say, a clear color. We have always a gray image because people are different, body reactions are different. We all have different, responses. But most of us will have at least 6 months of immunity after the vaccine was given. Protection will decline over the time because of the waning antibodies level and because of the changes in the circulating influenza viruses from year to year. So, should we get the vaccine or not? As a physician, I'm going to advise you. I will not speak about anyone. I will speak about myself. I got the vaccine in September this year. All of my colleagues here, all of our nurses, all of our front desk staff, we all got the vaccines because we believe on the effect of the vaccine. Again, it's a personal choice, but we all recommend that we all join that. So we will support ourselves, also support our community. For 2020, the vaccines we have this year, we have the trivalent, which is covering the H1N1, H3N2, and covered a different strand of the influenza vaccine. And we have the quadrivalent, which we commonly used right now, especially for the 65 and older, which is adding a fourth type of the vaccine. Those three plus the disease vaccine like virus. This particle of the virus, that's it's like that virus. It's a mutation that happened to the flu vaccine in the previous years. Quadrivalent vaccine will help us to be protected from the flu virus or from the influenza. Somebody will say, okay, in the past years, I never got the vaccine and I never got the flu. I will say this year is a different year. Why? Because we don't have just the flu. We have another enemy that we're still fighting, which is the COVID-19. So you will say, but those are two different viruses, and you didn't even speak about the COVID because it's not the topic for today, but I cannot ignore that the COVID now is existing and it causes most of the harm, and we would like to limit the harm. So if I can protect the whole society from the flu, at least I will focus on fighting the COVID only, not the COVID and the influenza. At the same time, I don't want to have two pandemics coming or spread of the influenza on top of the COVID or both together and causing more harm. We need to keep our society strong and healthy. So it's your choice, and I'm sure you all will do the right choice, and it's always good to get the vaccine. People will say, can the vaccine give me the flu? Vaccine doesn't give the flu. Vaccine can give a very mild symptoms that resemble the flu, but it's not the flu itself. It's a simple, maybe a day or two of fever, some ache, some pain, but it's very self-limited, and it is a reaction to your body, to the small particles that we just introduced in to help the immune system to be activated and start to protect us. Again, as I told you, I got my flu shot for the 2021. Thank you for listening to this lecture. I hope you will do the same. I am Dr. George Sidrak from Mountainside Family Practice in Verona, 799 Bloomfield Avenue in Verona, New Jersey. Our phone number is 973-746-7050. I will repeat again, 973-746-7050. I don't like to advertise to our place, but we are part of Mountainside Family, family, which is the Mountainside Hospital. That's part of the Hackensack Meridian. We accept new patients. We have the flu shots available for you here. We also here to answer your questions. If you have any questions, you can dial the number 973-746-7050, and you can ask about me in person, George Sidrak, or ask to speak to any doctor in our facility, and they will be able to answer your questions. We are here to help you. We are proud to be part of this society that we love and we care for. Thank you very much for listening, and please do not hesitate to call us if you have any questions. Thank you.